Hello everyone, welcome to sqadia.com, and in our first section of the lecture topic benign conditions of the ovary and pelvis, we will talk about ovarian tumors. In this section, we will talk what are benign ovarian tumors, what are different types of benign ovarian tumors, and what are the different types of adnexal masses that can be confused with the benign ovarian tumors. So, benign ovarian tumors are benign as the name shows. Benign tumors are non-cancerous. They are not malignant or metastatic. They most commonly occur in women in the reproductive age or in the childbearing age. Also arise in postmenopausal women, but as compared to reproductive age and postmenopausal age, the usually incidence is higher in the reproductive age women. Most benign ovarian tumors usually they cause no symptoms, so patient doesn't know if they have any benign ovarian tumor present or not. Large tumors are those that secrete usually the hormones. In this diagram here, if you see, they give you the picture of the ovary with the ovulation and different follicles, Graafian follicle, and then there is a release of the ovum or ovulation. Then different types of tumors here, they show you papillary cystic tumor. These are the papillary cystic tumor, which is the tumor of the surface epithelium, 65%. Then we have teratoma and germ cell tumor, 20%. In teratomas, usually we have tissues like hair, tissue, teeth, nails, different type of tissues are present in the teratomas. Then the solid tumors, there is 10% of solid tumors, stromal tumors, and then tumors which are metastasized to the ovary, we have 5% of those. So these are the different, how common is papillary cystic tumor is the most common, 65%, which is this tumor of the surface epithelium. Surface, and this is the surface, and this is the tumor of the surface epithelium. Then teratoma, which have hair and the teeth present in the teratoma. Then stromal tissue, which is the solid tumor, present in 10% of the cases. And benign ovarian tumor, usually they don't have any symptoms, and it's the tumor of the childbearing age. Now, different types of the ovarian tumor. We have functional ovarian tumor, inflammatory, germ cell, epithelial, and sex cord stromal. So these are the 5 different types of ovarian tumor, which are further subdivided into different types. So functional ovarian tumor is divided into follicular, corpus luteal, and Theca luteal cyst. Or for functional ovarian tumor is divided into follicular, corpus luteal, and Theca luteal. Then inflammatory type of ovarian tumors is divided into tubo-ovarian abscess and endometrioma. Whenever usually there is inflammation or infection, abscess is present, so tubo-ovarian abscess. Germ cell ovarian tumor is teratoma, also known as the dermoid cyst. Epithelial ovarian tumor can be serous cystadenoma, it can be mucinous cystadenoma, or it can be Brenner tumor. And then finally, sex cord stromal ovarian tumor is divided into fibroma and thecoma. Oma. Remember, whenever there is a word oma is the tumor. Oma, tumor. Fibroma, thecoma, endometrioma. Oma is used for tumor. This is the picture of the normal ovary and what are the different changes that occur during the process of ovulation. So first there is a primordial follicle here. Primordial follicle becomes primary follicle. Primary follicle becomes developing follicle. From developing follicle, it's a mature Graafian follicle. And then mature Graafian follicle rupture to form the ovum, and then this Graafian follicle, after ova is released, then it becomes the corpus luteum. Corpus luteum. Now, some differential diagnosis of adnexal mass. If there is adnexal mass present, it can be different things, but not only ovarian tumor. So what are the different differential diagnoses of adnexal mass? In the ovary, the adnexal mass can be cystic or solid. Cystic when it has a soft structure, it has fluid filled in it. Usually that's the cystic structure, and solid is definitely solid with nothing inside. So in the ovary, the cystic adnexal mass, it can be functional cyst, it can be neoplastic cyst, which can be benign, malignant, and it can be endometriosis. The solid in the ovary, solid adnexal mass, it can be neoplasm, again, which can be benign or malignant. So cyst can be benign or malignant. Solid can be benign or malignant. In the fallopian tube, there is tubo-ovarian abscess, hydrosalpinx. Hydrosalpinx is the fluid in the fallopian tube, and para-ovarian cyst. Around the ovaries, there is a cyst present. That's also the adnexal mass. Then solid is tubo-ovarian abscess. Abscess sometimes, if it becomes so hard that it gives the feeling of the solid structure instead of cystic structure. Ectopic pregnancy and neoplasm. In the uterus, intrauterine pregnancy in the bicornuate uterus usually gives the appearance of a cystic adnexal mass, or the pedunculated or interligamentous myoma is solid mass. In the bowel, usually we have sigmoid or cecum distended with gas or feces. That also give the mass, adnexal mass appearance. And then solid, it can be diverticulitis, infection of the diverticula. Diverticula are the outgrowth or projection in the lumen from the diverticula. Ileitis, inflammation of the ileum, appendicitis, or colon cancer. These can all present as solid adnexal mass. Then miscellaneous can be distended bladder, pelvic kidney, urachal cyst. All these can be present as adnexal masses. Then abdominal wall hematoma or retroperitoneal mass can be give the differential diagnosis of solid adnexal mass. Now, diagnostic evaluation of patient with adnexal mass. Complete physical exam is important. Pelvic ultrasound is important to find out the adnexal mass. CT scan with contrast or IVP is important to find out any adnexal mass. Colonoscopy or barium enema study if patient is symptomatic and presents some symptoms of involvement of the colon or the large colon, yeah, then we can do colonoscopy or barium enema. Then laparoscopy or laparotomy is also recommended. So these are some diagnostic tests for adnexal mass. You can see huge mass here. This is the huge big tumor removed. So physical exam, pelvic ultrasound, CT scan, laparoscopy, laparotomy, barium study, all these can be done to find out the adnexal masses. So that was all about the benign ovarian tumor, in which we talk about different types and differential diagnosis. Thank you for watching sqadia.com.